everyone. I am delighted to be here. I want to say how impressed I was with the Rice University students, the 360 Institute for Global Health Technology. You just stood up. I want to make a personal plea to you. I think you should all join the Peace Corps. You would be amazing volunteers. I also was delighted to be here. I didn't know I was going to hear about the Well Body Alliance and the Texas Children's Global Health Initiative, but those are fantastic initiatives, and we also, in some strange ways, have links already with Peace Corps. We have Peace Corps volunteers in Guinea, Sierra Leone, and Liberia, and we actually had to evacuate them, unfortunately, but our remaining staff are very much involved with the epidemic and with the Centers for Disease Control, and I know are working with those two institutions. And also, we do have partnerships actually with Baylor University in several countries in Southern Africa. We have volunteers there, and I've in fact visited your site. So we find that there are connections all over the place in terms of connecting Peace Corps with other partners in global health. I am mostly going to talk about Peace Corps and how we partner writ large. I'm going to talk about public-private partnership, but I'm also going to talk about the partnerships between communities and NGOs and what have you, because partnerships are what enable all of us to be successful. I want to start, though, by asking if there are any returned Peace Corps volunteers in the room or any family members of currently serving Peace Corps volunteers. If you are, stand up so we can thank you for your service. Anyone considering Peace Corps service here? Stand up if you are. Come on, stand up. Good. Thank you. Anyway, it's really a privilege to be here. I know that we share many things. We are both dedicated to communication, to discussion, to engagement, to solve some of our world's most intractable problems. And the fact that you have such a packed house on a Monday night is very exciting. I'm grateful to be here. I'm told that you've heard a lot lately about boots on the ground. And so I'm going to give you a little change of pace. I'm going to talk to you about sandals on the street. And today, when the news on the international front is almost overwhelmingly negative, I want to tell you some good news. I want to tell you about what Peace Corps is doing and the innovative work that our volunteers are doing from Azerbaijan. We have a couple of former volunteers from Azerbaijan, all the way to Zambia, and the power of partnership in accomplishing our great work. This is what Peace Corps is all about. It's about forging creative alliances and redefining the way development is delivered at the last mile in some of the world's most vulnerable, hard-to-reach communities. Since the founding of the Peace Corps 53 years ago, almost 250,000 Americans have served overseas in 140 host countries around the world, working on issues ranging from empowering women and girls to training and supporting the next generation of doctors, nurses, and health workers, to fighting disease in an increasingly interconnected world. Peace Corps' first goal is a development goal to build the capacity of host country individuals and institutions to achieve their own development priorities. Our volunteers help to reduce poverty and engender hope in some of the toughest areas of the world. And what we're doing is dealing with some of the root causes of instability that threaten our world. When you have people who are hopeless and have no future, then they are very vulnerable to forces that destroy. But when you have people who have hope and a future, they are people who will contribute positively to our world. So that's what we're all about. Our second goal is to promote a better understanding of Americans on the part of people served. And this is really the heart of Peace Corps. It's the work that volunteers do every single day, the relationships that they develop with their host communities. These transformative relationships lead to lifelong bonds between the United States and the leaders and citizens of our partner nations who, because of a Peace Corps volunteer, share our values, have positive perceptions of the United States, and are interested in collaborating with our country in a positive way. And then our third goal is to promote a better understanding of other peoples on the part of Americans. And this is something that you're deeply committed to too. You care about this, and this is in fact what your whole council is all about. So we share that goal. Today I want to tell you about one of our primary sectors. We actually have 6 sectors, but what I'm going to talk to you about today is our health sector, which is probably one of our most innovative sectors, and one in which we partner the most with other agencies, other private sector organizations, other NGOs. And we have also invested heavily in the health sector. We have about 2,500 to 3,000 Peace Corps volunteers right now serving in the health sector all around the world. Health volunteers work within their communities to promote important topics such as nutrition, maternal and child health, basic hygiene, and water and sanitation. Fighting HIV/AIDS is also a huge priority for Peace Corps, and volunteers play a lot of key roles in the fight against HIV, including training peer educators to prevent infection among youth, empowering girls and young women through job skills training and leadership camps, supporting orphans and vulnerable children, building supply chain management capacity at the district level to ensure the flow of life-saving drugs to communities. And that's a new thing that we're doing with the private sector, actually. Creating programs that provide emotional and financial support to families and communities that are affected by the disease, and then connecting pregnant women to programs that will help prevent the transmission of mother-to-child transmission of HIV. Because health is such a cross-cutting issue, many of our volunteers work in health even if they have another sector, even if they're agricultural volunteers. So they're doing things like they're teaching farmers about the health consequences of pesticide use. Or we have teachers who are teaching about the importance of hand washing and clean water in their schools. So many volunteers work in health. We currently have about 7,200 volunteers serving around the world. So as you heard from Linda, our health initiatives are near and dear to my heart. My whole career has been in the area of public health, and so I'm thrilled to be speaking to you here today. Before I stepped into this role, I spent 2 decades working in the area of maternal and child health and HIV, and I found my passion for public health as a Peace Corps volunteer. So I want to just share that story quickly with you today. Basically, my husband Steve and I served in a small island of Western Samoa in the Pacific, and we taught in a secondary school, an all-girls secondary school. But for me, the relationship that was most important for me, the one that was transformational in my life, was my relationship with my host mother, Losa. I was 25 when I arrived at Peace Corps, and my host mother was 32, and she already had 8 children. She had started her childbearing at age 15. So about 6 months after I arrived in Samoa, I came home to her house. We actually lived with her for the first year. And I found her weeping so badly that she could hardly breathe. I thought probably somebody had died in her household. But it turns out that the reason she was crying is that she had just found out that she was pregnant again with her 9th child. And she did not know what she was going to do. Her life was backbreaking. It began at 4 a.m., and it didn't end until 9 a.m. And during that whole time, she cooked 3 meals. She went to the farm. She helped her kids with homework. She ironed every single one of those school uniforms with a coal iron. She did all the housework. She washed the clothes by hand. That was her day. And she did not know how she was going to be able to survive. She had delivered every single one of those babies on the floor of her hut, attended only by her sister-in-law, who had no formal training. She had never been to a local health clinic for prenatal care. Now, there was a clinic 1 mile down the road, and she had been there for immunizations for her kids, but she had never been there for herself. And I knew nothing about pregnancy, literally nothing. But I knew that when my mom had been pregnant, she had gone to the doctor. So I said to her, why don't we go to this health clinic together? I'll go with you. And so we went, and there was a fantastic midwife there who took one look at her and said, you are really a high-risk pregnancy. Your last birth was only 14 months ago. Pita, his name was. So by the time the next baby was born, it would have been a birth interval of less than 2 years. She said, you are severely anemic, and you're at high risk. So you need to deliver your baby here at the health center. Her face just fell because she knew that her husband would not allow her to deliver her baby at the health center. So we went back to her house, and sure enough, her husband Vianney said, I'll let you take the iron tablets for the anemia, because they're free. And maybe I'll let you go to the health clinic. But there is no way you're going to deliver that baby at the health clinic, because Samoan babies enter this world at home surrounded by the people who love them, which actually is a beautiful thought, isn't it, if it wasn't quite so dangerous. So anyway, Los and I kept going down every month to the midwife, and the midwife was fabulous. After the second month, she started coming back with us to the house, and she sat with Vianney, and she drank tea with him, and she explained to him all the dangers that were posed by a woman who was having her 9th child and with such short birth interval, who were severely anemic. Finally, after 7 months, Vianney agreed that she could deliver her baby at the health facility. So on the night her little baby was born, it was pouring rain, of course. We put her in the back of the truck, pickup truck, drove her down to the health clinic. 5 minutes later, she delivered her baby. Healthy little baby girl, Margarita. And about 5 minutes later, she went into postpartum hemorrhage. She had a uterine rupture. She would have died, except she was at a health clinic with the right drugs, with the right, they had a doctor who was on call, with the right supplies. They had blood. They were able to save her life. I like to say that my career in public health was born that day, because seeing the difficulties of a woman in a traditional society where she had absolutely no control over her own health care, seeing how, from any health planner's perspective, she had excellent access to health care. She was only a mile away on a good road, but there were so many cultural barriers keeping her from accessing the care that she needed and deserved, that really her life depended on. And just understanding also the importance of relationships and trust, and that's going to come back as I continue to talk to you today. Relationships and trust. That was what the midwife was able to develop with her husband, so that her husband felt comfortable allowing his wife to have her baby at the health facility. That changed my life and became my passion. And I continued to work in public health until I was fortunate enough to come back to this agency that I've loved so much. My service, my Peace Corps service, shaped my career in so many ways, and that is the experience of so many other volunteers. So now I want to speak more about how we're creating strategic partnerships so we can have strategic results. The iconic view of Peace Corps, the view that you probably all have in your head right now, is of a volunteer working all by themselves, off the grid in some remote community, utterly disconnected from the rest of the world. Is that right? Yeah. And that's sort of the way it has always been, actually. But in our interconnected world, the security and the economic prosperity of our world is inextricably linked with that of others. And even our most developing countries are also inextricably linked with the rest of the world. So what happens in one community has a dramatic effect on another, and all you have to do is open the newspaper today to notice that. And today, developing countries from Nepal to Vanuatu have development plans that reach all the way down to the community level. Every single community has a village development plan, and they want to know how Peace Corps volunteers are helping them achieve their goals. So we're connected in ways that we never were before, and our villages, our communities, even if they're poor, they do have development plans that they are expecting us to help them achieve. And of course, we have today's technology, which links volunteers and even host country nationals with the rest of the world. Today, more people have access to cell phones. More people have cell phones than have latrines, safe latrines. So technology is taking over and connecting people as never before. And this can be a tool that can be put to good use. And I think you saw some excellent examples back here of how really simple, appropriate technology can literally save lives. These were such great examples. And I really hope that Peace Corps volunteers can somehow later on, after you've gone through your clinical trials, I really hope that we'll be able to help implement and use some of these tools. Peace Corps volunteers will always work at the grassroots level on some of our world's most toughest issues, but they are no longer working in isolation. They are working in partnership with others because they have to. They work closely with other development partners to make sure that the interventions, the projects that volunteers are working on have proven through evidence to be most effective at achieving development results. We are committed to making sure that the work that our volunteers do is the work that can achieve results at the grassroots level. And so we have embarked on a very extensive reform effort to help us be as effective and strategic in partnership with others as we ever have. I also want to say that I really believe that we're one of our nation's most cost-effective investments. Do you know that $1 for every American is more than our entire budget per year? If every American gave $1, we'd have even more money than we have right now. So that's how cheap we are. We are a very good investment for our country. So I just want to talk about how private sector can really be engaged in health. And you've seen a couple of really good examples just now. Today, 80% of all capital flows to developing countries come from the private sector, and only 20% come from foreign assistance. Now, that is exactly opposite of 20 years ago. 20 years ago, 80% of all capital going to developing countries came from foreign aid, and only 20% from private sector. So commerce and trade are really major drivers of development right now. So public-private partnerships, because they bring knowledge and they bring money and they bring know-how, they can be extraordinary innovators for powerful impact. So through partnerships with organizations like Coca-Cola, Peace Corps volunteers are helping to pilot and innovate and implement new innovations that can save lives. I just want to give you one example. In 2012, Peace Corps launched a strategic partnership with the Water and Development Alliance, which is a partnership between USAID, Coca-Cola, and the Peace Corps. And it's focused on sustainable water projects that helps communities lift themselves up. Through this partnership, 1,000 Peace Corps volunteers and local counterparts in Africa are receiving dedicated training and piloting hygiene interventions, from latrine construction to raising awareness about hand washing and water treatment. We want to make sure that all those people with cell phones also have access to clean water. With Coca-Cola support, volunteers are helping to improve local capacity to deliver sustainable water supply, sanitation, and hygiene services in order to reduce waterborne disease. It's the leading killer of children around the world. Now, water and sanitation may not be what you think about when you think about, innovation, private sector innovation, but in reality, it's one of the most important things we can do in terms of saving people's lives. And that's why Peace Corps is so proud to be part of this partnership with Coca-Cola. I want to talk briefly about another partnership that we are doing, and that is a partnership around malaria. And this is a partnership that we're doing with the President's Malaria Initiative, which is a U.S. government program to fight malaria. Malaria No More, which is a large international NGO, with the National Malaria Control Program of Senegal, and then Peace Corps volunteers. Now, as part of this partnership, a couple of years ago, Malaria No More donated bed nets, thousands and thousands and thousands of bed nets. And the President's Malaria Control Program gave guidance and technical support. And we partnered with the National Malaria Control Program to be able to do universal distribution of bed nets for every sleeping space. So historically, the way bed nets have been given out is that when they went around and they gave 2 bed nets to every household, no matter how many people lived in the house. If there were 2 people in the house or if there were 23 people living in the house, they'd give 2 bed nets. So the innovation there was that actually you'd go into the house, count how many people were there, and then you'd give the right number of bed nets for every sleeping space. And so this was an important partnership. We mobilized hundreds of Peace Corps volunteers to participate in this effort to distribute bed nets to every sleeping space. So one of our volunteers, Ian Hennessy, in southeastern Senegal, in an area called Kédougou, which has the highest malaria incidence in the entire country, he and his community health workers started working on this bed net distribution program. And they blanketed their village. Every single person had a bed net. Every sleeping space, every person slept under a bed net. Well, Ian's best friend was a guy by the name of Sheikh. And Sheikh was a community health worker with Ian. And together they did this big campaign, and they also did other, community health work as well. Sheikh had a wonderful little niece named Jenaba, who was 4 years old. And Jenaba was the apple of their eye. She played outside and they loved her. Well, one day, about a week after they had completed their BedNet distribution, Jenaba got a fever. She got sick. 2 days later, she died of cerebral malaria. How is this possible? Jenaba was sleeping under a BedNet, you might ask. Well, the truth is, children and adults aren't always under their BedNets when mosquitoes bite. So mosquitoes can bite at dawn and at dusk when Jenaba was playing outside. And there is a reservoir, a latent reservoir of malaria that exists within people who have developed immunities over the years. Some of these people have no symptoms of malaria whatsoever, yet they are able to transmit. So Jenaba was bitten by a mosquito that had bitten somebody else who was not being treated for malaria. The whole community was devastated, in particular Sheikh and Ian. And so they put their heads together. They said, what can we do that's going to change the trajectory of malaria prevention in this community? And so they decided what they really had to do is attack this reservoir of malaria. So they decided that they wanted to go house to house to using rapid diagnostic test kits that were now available. And they were going to test every single person. Actually, what they were going to do is ask them, is there anyone who has fever, aches and pains, nausea? And if there were people with those symptoms, they would test them for malaria. And if they were positive, they would treat them on the spot. And if they had severe malaria, they would accompany them to the hospital. But not only that, if they found someone in a household that had malaria, they tested other people who were also in the household to try to get at that latent reservoir of malaria. And they got the support of the National Malaria Control Program that agreed to give them all of the drugs they needed and all the rapid diagnostic test kits that they needed. And they got the support of our U.S. Centers for Disease Control that agreed to do the monitoring and evaluation. So they did a baseline study. They found another community about 30 miles away that had the same BedNet distribution coverage rate and the same malaria incidence rate. And they set out on this proactive case detection, going house to house to house. It was very intensive, 500 people in their community. They did it for a whole rainy season. And at the end of the rainy season, the CDC research showed that the difference between the control village, where there was no proactive case detection, and Ian's village was a 90% reduction in malaria incidence, 90%. So then they thought, well, okay, this was a great intervention, but extremely time intensive. It involves community health workers going around. Can we do this at a larger scale? So they decided to do it with 10 villages, with again 10 control villages. Same result, 90% decrease in malaria incidence after a rainy season. So this last year, we did it in a whole district, 145 villages, again, a control district. 145 villages, 17 Peace Corps volunteers, thousands of community health workers. The exact same result. This time it was an 88% decrease in malaria incidence. It is changing the face of how malaria is prevented and treated at the community level. And what's important here is the partnership. It was a very rigorous partnership between the President's Malaria Initiative, because they oversaw this, the Centers for Disease Control that did all the monitoring and evaluation, and the drugs that came through the regular Government of Senegal program. This was an intervention that cost no extra money except mobilized people. But it is changing the face of malaria. And they are actually talking about the possibility of no malaria in Senegal. It has now become the basis for their National Malaria Control Program. It's made a huge difference. And this is the reason. It's because a Peace Corps volunteer living and working in their community has a window into what the problems are and what the possible opportunities are. And then they can work with the local people to identify a solution that makes sense for them and is sustainable over time. And that is the value added of Peace Corps volunteers. And that's just a story to do it. So what I want to just leave with you, and I'm going to just say a few more things, and then I'm going to tell you one more story, because my favorite thing to do is tell stories, frankly. What Peace Corps brings to the table is on-the-ground capacity that can be broken down in 3 distinct ways. Number 1, we ensure that public health initiatives funded by others, so in this case the President's Malaria Initiative, are implemented properly, owned by the community, monitored and evaluated, and sustained over time. Number 2, Peace Corps volunteers can ground truth interventions and support local innovation to improve the effectiveness of those interventions. So they ground truth them. And then third, far beyond just parachuting in with short-term Band-Aid solutions, Peace Corps volunteers help to build long-term capacity that leads to sustainable change over time, changes that the community owns. So in this case, this proactive case detection program, the government of Senegal is taking it on, and those community health workers that have been doing it are now capable of doing it and are themselves becoming the trainer for other community health workers throughout their country. We have now expanded this program. We now have 3,500 Peace Corps volunteers working throughout Sub-Saharan Africa in 24 countries, introducing this concept. We have a new initiative, it's called STOMP, Stomp Out Malaria in Africa, and we're really excited about its potential. I think I'm running out of time, so I just want to talk about one more thing, and this gets to what you were hearing about with the Alliance. You heard about how important it is to have trained health providers and health systems that function. It's such a huge problem throughout the world, and Ebola has just decimated an already very fragile health system. So for years we have been asked by host countries to send doctors and nurses. And it just didn't really work for us. What we really mostly send are health educators, community health workers. We haven't sent doctors and nurses. But last year we decided that we're going to try it. So in partnership with another organization called Sea Global Health, which is a nonprofit organization, we formed the Global Health Service Partnership, where we send doctors and nurses to 3 countries in Africa to serve as clinical mentors and adjunct faculty at nursing schools and medical schools in Malawi, Tanzania, and Uganda. They serve as Peace Corps volunteers, which means that our program to place a doctor to build health capacity is 1/6 the cost that our government currently spends to place a doctor to do the exact same thing. 1/6. Now why is that? How is that possible? Because they're Peace Corps volunteers. They don't receive much of a salary. And these are people who are devoted to their communities, who learn the language and the culture, but they're working as medical faculty, and they are amazing people. We were able to get the head of the pediatrics department at Dartmouth Medical School to go and be a Peace Corps volunteer as part of the Global Health Service Partnership. A man who was the head of emergency services for LA County. He's a Global Health Service partner. So we're able to attract amazing people who want to make a big difference. So there's a volunteer named Brittany Sullivan who's a pediatric nurse practitioner, and she's teaching third-year pediatric nursing students in Malawi. She's helping to train local healthcare professionals in clinical and classroom settings. It's resulting in stronger health systems, and it's also increasing the availability of health services in her area. And what she says is it's about seizing an opportunity to build capacity rather than a Band-Aid approach. So we've only been at this for 1 year. We started out with a class of 30, 15 doctors and 15 nurses. And what they're really trying to do is to change the way that medical educators interact with their students. It's always been very hands-off, frankly. There's been a little bit of book knowledge, and then they send the student nurses and the medical students to the hospitals with very little oversight, very little engagement, very little practical training. So they're really trying to introduce new treatment regimens, new techniques for engaging students in the care of their patients. So our inaugural class of GHSP volunteers helped to improve the quality of medical education for more than 1,000 students in 11 different medical schools and nursing schools. And here's just a few examples of things that they did. There's a nurse in Malawi who introduced new modules on infection control. Hospital-acquired infections are a huge problem, even in our country. But anyway, she helped to demonstrate some very simple infection control methods, which are actually being, those same infection control methods are what we're promoting in Liberia, Sierra Leone, and Guinea right now. And the result was in her hospital a dramatic decrease in the number of hospital-acquired infections. Then there is a physician who demonstrated his compassion by treating their refugee patients with such care and kindness that the other medical students were amazed, because the tradition there was that they treated refugees very poorly. And so it began an opportunity to talk about the importance of doing no harm and of really providing compassionate care for all patients, regardless of who they were or how much they could pay. So just changing the patient-doctor dialogue. And then the OBGYN, who actually would have been a good person for Rice 360, she saw that there was a major problem with fistulas, and they had no models to practice on. So she, looked around in her community, and she found some rubber and some string, and she developed a kind of a vaginal model where medical students could practice doing fistula repairs. Because prior to that, they had no way to practice, and then they were confronted with fistulas and didn't really have any practical experience whatsoever. So these are just 3 examples of how our Global Health Service Partnership volunteers are really helping their communities and helping build the next generation of healthcare leaders in Malawi, Tanzania, and Uganda. We now have put 45 health volunteers in the field this year. We have 45 more, and so we're very excited about that and hope it's going to be great. So the heart of Peace Corps always has been partnership. I gave you an example of partnership with Coca-Cola, which was a private sector partnership, an example with Ian Hennessy and his partnership with Malaria No More and the National Malaria Control Program. And I really firmly believe that the Peace Corps' value added is really the relationship of trust that comes between a volunteer and their community, based on time spent with them. It's a relationship between a volunteer and their coworkers, between a volunteer and their host family. It's a relationship between our nation and the 140 nations around the world where we have worked over the years. And so I really think that the most important thing that Peace Corps volunteers bring is relationship. They are our face in the developing world. They are our face, the face of our country in the developing world. Not just among the elite, the powerful, the well-educated, but among the average citizens, the vulnerable, those who have so much potential, but it's entirely untapped. People who with a little boost could make a huge difference for their community, for their country, and their world. And I want to just close with one more story, which is an example of that very thing. When about a year and a half ago, or it's been 2 years now, I had the opportunity to meet with President Alpha Conde, who is actually the president of Guinea. And he was in Washington visiting President Obama, celebrating democracy in West Africa. And it's common for presidents of countries with large Peace Corps programs to request an audience with me, and so I was delighted to go and meet him. And he told me that he had a Peace Corps volunteer in his history. So I said, please tell me about it. And he said, well, when I was a young man, there was a Peace Corps volunteer named Joe who lived in the hut next to me. Joe is an agroforestry volunteer. So he spent his days working with farmers. But every evening he opened his home for homework help for any student in the entire village who wanted it. He would help us with our math, with our science, with our English, and with our French. Some days there were 2 kids, some days there were 15 kids, but he would be there every day for us. And I went there nearly every day because I was finishing up my high school and I needed to take the school leaving exams. At the end of those 2 years, I took my final exam and I passed. I was one of 4 students, all male, from my country, who passed the university entrance exam. He said, I know that beyond a shadow of a doubt, I would not have passed that exam and I would not be president today if it weren't for Joe. But more important than his homework help was that he believed in me. He was the first person I can remember who ever believed that I had a future outside the boundaries of my village. He helped me imagine a different future for myself. So he said, but even more important than the impact of Joe on my life, which is profound, is the impact of your volunteers on the lives of my people. Over the last 6 months or a year when I was campaigning for presidency, I went to over 300 villages around my country. I went to villages way out east where I couldn't get my own campaign staff to go. Too far away, too remote, the roads are bad. But there were Peace Corps volunteers there. I went to villages way up north, which are very dry and Saheli, and it's right next to Mali. It doesn't rain for 9 months a year, and there's not that much variety in the diet. He said, you know, to this day, I don't have a district governor there, but there are Peace Corps volunteers there. And then I go to the center of my country, which is where I'm from. There's actually a big road there that was built by the Chinese. He said there are lots of big international NGOs that are there, and they do great work. They go and they build schools. They drop off bags of rice with food aid. They help build health clinics. They do great work. But you know what? At the end of the day, those folks get into their big white SUVs and they drive back to Conakry. Your Peace Corps volunteers, they stay. By your presence, you show us that America stands with us. That your country stands with us against poverty, against disease, against inequality, against violence. You send us your most important assets, your sons, your daughters, your mothers, and your fathers. You live among us as family. You learn our language, even though some of our language is not even written down. You eat our food, even though it often makes your belly sick. You work on our priorities, not yours. By being present in our villages, living as family, building relationships of trust, you validate us. You validate my people. He used the word validate 3 times. You validate my people. My people are proud to teach you our language. They are proud to share our culture with you. They are proud to call you family. They are proud to work on our joint priorities. They are happy to work with you because they trust you as family. You are the heart and soul of America, and the gift you have given us is greater than the millions, maybe billions of dollars that your country has given us over the past 50 years, because you give us a hand up and not a handout, and that makes all the difference. Now, I hear stories like this everywhere I go, and I travel a lot. It's not always a president, although 12 presidents in Africa alone right now have said that they got their start from a Peace Corps volunteer. Sometimes it's a mother, sometimes it's a nurse, sometimes it's a teacher, sometimes it's a mayor. Even if it's been 40 years since that person last saw their Peace Corps volunteer, they can tell you everything about that person. Many of us question whether we really did anything. Did we really have an impact? And I can tell you unequivocally that you did. most of us also feel that we got more than we gave, that the love and the support and the encouragement of our families was far greater than anything we were able to give away, and that may actually be true as well. And that's part of the synergy of Peace Corps, because the whole is greater than the sum of its parts. We are an organization that builds hope and a future. And I hope that you're very proud of it, because this is one of America's best ideas. When Peter Yarrow of Peter, Paul and Mary, he interviewed the Dalai Lama on Japanese TV, sort of a strange combination. But anyway, he asked the Dalai Lama, what is the best thing that the United States ever gave to the rest of the world? He said the Peace Corps. Now we're small, we're tiny. Our budget is $379 million. We have 7,500 volunteers. But we are an agency with heart, and we represent our country so well. I just want to thank you for your support for All Things International, for caring so much about other countries. It's so important that our country knows about others. I really, truly believe that the future of our country depends on our ability to be able to work effectively with other nations. And so all of us have to be globally competent. And the World Affairs Council does so much to make this possible. So that's all I have to say today. I want to thank you for your attention. And if there is time for questions, I'm happy to answer them.
I'm going to give you to the students, so we won't be questions.
Okay.
You know, we're going to not take traditional questions because I did want Ms. Radlett to be able to talk to many of the students I know are thinking about a Peace Corps career. So first, let me thank all of the Houstonians that are a positive face of America around the world, the people at Well Body Alliance, everything Texas Children's does, and of course the Peace Corps and Carrie Radlett. Thank you so much for what you do.